All right, thanks so much, folks. We're gonna get started. So I saw in the chat, folks are enjoying the conference. They are enjoying the music, just trying to keep it lively. Next time we're able to host this conference, hopefully we'll have an in-person dance party so that we can get grooving and make some of those connections and strategize as we really support this work to really advance work related to adverse childhood experiences and ways to mitigate toxic stress. Today, I have the esteemed pleasure of bringing together a dynamic panel to really talk about the different ways and strategies that we're advancing both locally, regionally, and at the state level to advance opportunities to help support our families as they mitigate the toxic stress that they experience in their life. And as we walk through some of the issues that have been impacted, they've been impacted because of the pandemic. Today with us, we have Dr. Kern Mark, Medical Director with the California Department of Healthcare Services. We also have Jeremy Tobias, Executive Officer with Community Action Partnership of Kern County. We have Guadalupe Manriquez, Assistant Program and Budget Manager with the California Department of Finance. And we have Marisol Ibarra, Legislative Director for California State Senate. Today, the hope is to walk a number of questions, have conversations around the different strategies that we're employing collectively and they are through their respective organizations and systems to support families. As similar to like we did in the first panel this morning, feel free to use the chat to let us know what your comments are. Also, please feel free to use the Q&A feature to ask questions. We'll draw on these questions to moderate the conversation that we'll have collectively this afternoon as we kind of walk through the day. So without further ado, what I'll do is I'll have each panelist, you all have extensive bios and extensive work, but want to give you the opportunity to, talk a little about yourself, the agency that you represent, and some of the work that you've been doing to really support families. So how about we start with Guadalupe Manriquez.
Thank you, Hector. It's a pleasure to be here with these amazing panelists and speaking to you all today. As Hector mentioned, my name is Guadalupe Manriquez. I'm an Assistant Program Budget Manager for the California Department of Finance. So here at Finance, I oversee the Medi-Cal portfolio. Our program is very expansive. We cover services from behavioral health, physical health. So very excited to contribute to this panel today. At the California Department of Finance, we advise the governor and put together an annual spending plan for the state, which includes significant policy. On a personal level, I am from a very small town, Helm, California, in Fresno County. So very excited to be in this conversation with a very important region of the state.
Thank you, Guadalupe. Marisol?
Thank you, Hector. So so my name is Marisol Ibarra. I am the Legislative Director for State Senator Melissa Hurtado, who I believe you guys heard in the morning. This morning she was a keynote speaker. But as Senator Hurtado's Legislative Director, I help manage and lead Senator Hurtado's legislation and budget requests. I've been part of her legislative team since she got elected to the Senate. In my role as Legislative Director, I oversee all issue areas, but I think, my main niche is the health and human services area. I think as a first-gen professional myself and graduate, I think I've seen how ACEs can really support, communities. So I'm really excited to be here. And I thank you, Kern County First Five, for inviting me today to be part of this amazing panel.
Thank you so much, Marisol. How about Dr. Mark?
Hi, thank you so much, Hector, for inviting me, and I'm very pleased to be here speaking with all of you. My name is Dr. Kern Mark. I'm the Medical Director at the California Department of Healthcare Services, which administers the state Medi-Cal program. And I'm also an infectious diseases physician and internal medicine doc by training, taking care with a history of taking care of people with HIV. And so I've really seen over the course of my career some of the many, unfortunate health sequelae of people having experienced ACEs as children, and then, both seeing the struggles that they've seen, as well as if we screen for ACEs and we treat toxic stress, seeing how that can really help improve people's lives. And then through the Department of Healthcare Services, we fund the ACEs Aware program, which trains Medi-Cal providers throughout the state to screen for ACEs and toxic stress, and then helps to create networks of care and link patients to the resources that they need to be able to live healthier, more fulfilling lives. So I'm very pleased to be here.
Thank you so much, Dr. Mark. Jeremy?
Thank you, Hector. My name is Jeremy Tobias. I am CEO of Community Action Partnership of Kern. I'm happy to be here with this wonderful panel today. Excited about this conference. Community Action Partnership of Kern is a community action agency serving Kern County and portions of the Central Valley. We provide about 16 distinct programs to assist our clients and families with battling poverty and fighting some of the inequities in the system to help them achieve their version of the American dream. And I know I'm excited to be here because ACEs is a fascinating topic. And I know probably like some of you back, I don't know, 5, 6 years, 7 years ago, when you first watched that TED Talk by Dr. Burt about ACEs, where you had the aha moment, you're like, oh my gosh, this answers so many questions for me when you're trying to think through generational poverty and why it's so difficult to break that cycle. And you listen to that and you start looking into ACEs, and there's a lot of answers there. So it's a fascinating topic. We've been trying to incorporate it into what we do here at CAPK, and I'm excited to be here and talk a little bit about that today.
Perfect. Thank you so much, Jeremy. So my first question to the panel really focuses on this, in the framework around equity, right? We've talked about adverse childhood experiences, the deployment of resources to make sure we combat that, both at the state level with our Medi-Cal provider training, and then locally for families to understand, what ACEs is and how it can be used to really understand and plan for their health and well-being. So when we think about equity, what strategies are each of you, through your respective organizations or through the policy making that you're making, operationalizing equity so that the families that we're serving are thriving in the communities that we serve? Let's start with Marisol.
Well, yeah, thank you, Hector. So I think equity is being talked about a lot in the policy space, but I think in general, at the local level, at the state level. But I think, in my role as legislative director, I think when we draft legislation, I think, Senator Hurtado, oftentimes we have these discussions, and how do we make sure that these dollars go to the communities that need it the most? Oftentimes, we do encounter times where, we're trying to send funds to Senate District 14, but unfortunately, if we're not intentional with sometimes, just sometimes putting, first come, first serve, I think that really does sometimes, in areas where there hasn't been investment, there's no existing infrastructure so that they can tap into these dollars. So I think sometimes we have to be very intentional in making sure that we do call outs. And making sure that these dollars go to these regions, in particular in Senate District 14.
Great, thank you. Guadalupe, can you speak a little bit about some of the resources that are being deployed at the state level through the administration to really support ACEs in the work?
Yes, thank you, Hector. So first and foremost, just want to start with the quick few stats that you all may already be tracking. So, our Medi-Cal program serves over half of the school-age children in California. Over half of the state births are on Medi-Cal, and roughly 70% of the Medi-Cal population is Black, Latinx, or folks of color. And so with those stats, that is to say that our Medi-Cal program is advancing equity, right? Just by who we serve, who the state serves. This year's budget includes very exciting proposals that continue to advance equity. Equity is one of the pillars of this year's proposal, including improving affordability. So, most notably, the governor's budget proposes to expand Medi-Cal to all income eligible Californians, regardless of immigration status, starting January 1st of 2024. And this May, Medi-Cal will be available for individuals who are over the age of 50, regardless of immigration status. So this is a significant policy, for California to be covering all individuals, regardless of immigration status, which will make healthcare more affordable, more accessible, and make ACEs more widespread for the entire population in California. So the state continues to implement CalAIM. We continue to make significant investments in behavioral health. The Children and Youth Behavioral Health Initiative is, we're continuing to advance that. So there's a lot happening in terms of, the state embarking on policies that advance equity and, to try to transform our healthcare delivery system.
Thank you so much, Guadalupe. I know there's an infusion of resources that are happening across the state and moving locally. Dr. Marks, can you really talk about, what that means for ACEs as, the initiative goes statewide? We saw the implementation of SB 428 that Senator Melissa Hurtado sponsored. What does that look like as we think about, targeting families across the state, across the geographies that we're serving?
Yeah, I guess I'll just piggyback on what Guadalupe said, which is that, Medi-Cal certainly serves some of the folks who really need support the most. And, we started with funding ACEs screening in Medi-Cal, which is in and of itself is really addressing health equity. And then I guess just further adding that we are using, evidence-based systemic approaches to care. The ACEs screening tools that we, that are used as part of the ACEs Aware program, both the ACEs questionnaire for adults and the PEARL screening tool for children. These have been implemented and evaluated in diverse communities, and they found to be acceptable and helpful in all communities. They're available in all the threshold languages. And then I think, beyond that, the ACEs Aware work has really, I think, focused on how we need to operationalize equity by, really speaking about and acknowledging the harmful effects of trauma, including historical trauma, structural inequities, and sort of tying that to ACEs. We have known effects of discrimination, such as LGBT children who are unfortunately more likely to be singled out for abuse because of discrimination, among adults, and that then leads to ACEs, and then if we can support screening for ACEs and support treatment of toxic stress, we're in turn, helping people to address disparities and have better lives. So we just want to focus on sort of how screening for ACEs and that trauma can really help improve people's health.
Great, thank you, Dr. Marks. Jeremy, can you speak a little bit about the work that you're doing locally? I know you have a presence in Kern County and then some of the other Central Valley. How do you think about the deployment of these resources like ACEs to really support communities and some of the anti-poverty work that your organization is doing to support families?
Well, at CAP-K, one of our beliefs is that really, if we want to battle inequities and battle poverty, especially multi-generational poverty, it's not just about access, but it's access to holistic programs. And we're really pushing the focus in our programs are more of a more holistic approach. Some of our programs had the infrastructure in place, and now they're expanding that. And I'll use an example. Our Head Start program kind of naturally has a holistic whole family approach, and we're really capitalizing on that. And I think the ACEs program has emphasized the fact that you really need to treat the whole family in the holistic approach, or else we're never going to really be able to make an improvement on some of this generational poverty that we continue to see and we've had a hard time trying to break. And like I mentioned earlier, the ACEs approach, when you think about it, is kind of the aha moment where you're thinking, you can visualize some very targeted approaches, and many of our programs are very targeted about specific issues we're trying to address, or you can look at a more whole family approach. And it's really a change, that takes a while to really operationalize in your agency, but it's important. And we've been utilizing that Head Start model and that whole family approach to try and spread that throughout our agency into some of the programs we operate. And we see tremendous success when you use the whole family approach.
Thank you so much, Jeremy. Yeah, I definitely have heard throughout the day, right, the need to really support holistic ways of including families. How do we think about targeted resources to really support the work that's evolving across, the families and geographies that we're serving? And I think one of the things that we've seen across California and because of the pandemic is the need to pivot, the need to reorient as legislation comes to fruition, right? We had a surplus before the pandemic started. We were going a certain path, but then we had to pivot. Can you all talk a little bit about how your respective agencies have had to pivot because of the pandemic and how that has translated into either policy or resources being deployed to really support communities during those difficult times? And I'll let anyone take the question.
Well, I'll jump in first. Community Action Partnership of Kern, obviously, as many of us are in the same boat, we were used to providing services face to face with our clients, and we felt that was really important to do, and it is important in some respects, but we were able to pivot pretty quick and provide services in a manner that maybe was slightly different. For example, our food bank, I'll utilize our food bank as an example. Right at the beginning of the pandemic, we saw a tremendous spike in food needs and food insecurity in the county. And our food bank was distributing maybe about 2 million pounds a month of food. And within the first few months of the pandemic, that jumped to 3 million pounds a month. So it was all hands on deck at the food bank. And we also had to figure out a way to distribute that food, meeting guidelines and safety guidelines. So we were able to do that. We accomplished that through drive-through events and pivoted. And the same with some of our other programs as well. We were able to provide those services utilizing methods that maybe we hadn't thought about before. And it really did shine a light on, again, I think the pandemic came back to the holistic approach, shined a light on you're really dealing with the whole family. And it's a whole family approach. It's not any individual or any small need. It's a whole family approach, and it's families that need services throughout the spectrum of services. And it's not usually just one small service, but a whole spectrum of services that they need, and the entire family needs to be addressed.
Guadalupe, Marisol, any thoughts on, how policy has shifted because of the need to respond to community?
Yeah, absolutely. I think, process-wise, things drastically changed for us. But I think, we quickly, try to make sure that whatever was needed in the communities was going, was streamlining. I think that was kind of the main goal. I know many departments, really supported in being able to, say we can waive certain requirements because we usually do this process this way. So I think that really helped streamline different programs. I know that food banks was something that, Senator Hurtado was constantly working to making sure that food banks all around the state were able to access, have access to what they needed. I think oftentimes, Senator Hurtado is constantly, championing Food for All, which is a bill that would make sure that no matter your immigration status, that you get to access food through this. It's similar to what we have CalFresh, but for our immigrant communities. So I think just being really grateful for all the departments that were able to quickly work with our offices to make sure that the resources got down to communities.
Thank you.
Yeah.
Just add that, oh, go ahead.
I was just going to say, that as far as the budget process and, how we think about priorities, working with the governor's office and the administration, you will see over the last few budgets, that equity is like I mentioned earlier, one of the things we've been prioritizing, right? Like we acknowledge that there's been some longstanding inequities that we are trying to address with a lot of the investments that we are proposing in this governor's budget. And now I think the challenge for us is going to be, how do we address COVID-19, related, challenges in access to care, gaps in services. And so, how are we as a state thinking through how we can ensure that the last 2 years hasn't deepened those, those inequities. So I know one of the proposals that we're moving forward this cycle is $400 million for practice transformation grants to locals, to local entities, to really focus on advancing equity, as well as closing those COVID-19 driven gaps in services. So did want to highlight that as well.
And I think from my perspective, COVID unfortunately really brought to light a lot of the health inequities that have been present, for decades and centuries even, and I think catalyzed a lot of movement towards helping to address health inequities, which is a good thing. So the other thing it really brought to light was longstanding needs in the mental health arena that I think, people weren't always talking about, but I think people are talking about more now that we have, because of the experience with COVID, particularly around children. And just wanted to highlight the Governor's Children and Youth Behavioral Health Initiative, which is really an effort to focus on some of the mental health needs of children and teens and young adults, and focus on prevention efforts to support them and to support their families in kind of a whole family model. And certainly our ACEs Aware efforts have also been similarly, really trying to make sure that we're supporting families, children, families, and everyone.
Great, thank you, Dr. Mark. I know one of the things that we saw from the state was, the ACEs planning and implementation grants. Can you talk a little bit about, what some of the innovation and opportunities that those grants yield to really support the movement of this work for decades to come?
Yeah, certainly. So we've given away, quite a bit of funding, both for training providers for ACEs and through our network of care, planning and implementation grants. And these are really designed to work with the community to provide, to create networks of care to support people, children and families and adults who've experienced ACEs and toxic stress, to then treat that toxic stress and help folks to lead healthier lives. And we've funded those throughout the state. This is an example of some of the work that we're funding. And what we really heard from both people who've experienced ACEs as well as providers, we don't want to screen for something unless we can provide the support that people need. And the goals of those grants were to help provide that support in the community.
Great, thank you, Dr. Marks. I know, Marisol, you were instrumental in supporting Senator Hurtado moving SB 428. Can you talk a little bit about some of the challenges and opportunities that you see as now we've been able to make the historic law and move it forward in communities?
Yes, absolutely. So we so SB 428, which would require healthcare plans to contract either healthcare services, contract, or insurance policies, to be able to screen for ACEs screening. So I think some of the challenges that before it got to the governor's desk and ultimately he signed it, I think some of the challenges were just getting on board with, the plans, making sure that, that they can implement this program and that they were able to just, be able to do it all across the board. I think now that the bill was signed by the governor last fall, I think some of the challenges that we've been, kind of hearing from Department of Managed Healthcare is I think, how do we make sure that all the physicians are trained? are trained for ACEs. And I think that's ultimately the challenge that we are currently experiencing. So I think these are things that we in our office are often thinking of. How do we make sure that our physicians are prepared? Does that mean, you know, a training? What does that mean? Because I feel that is what is kind of delaying, you know, folks in being able to access these screenings. I think, you know, for Senator Hurtado, she is constantly working on our healthcare workforce. I think oftentimes we have to make sure that the workforce is ready. I think last year she was able to secure funding for the California Medicine Scholars Program, which is a program that trains our community college students to ultimately become, you know, become doctors. But we understand how hard it is sometimes to navigate higher education, how hard it is to you know, make it all the way through. So just making sure that they have the support system, if it means having a mentor as a doctor, or if it means having, you know, internships and just being able to be embedded in the community. I think ultimately research shows that they stay in those communities. So those are just some things that oftentimes we in the office of Senator Hurtado, we are thinking on how to make sure that that folks also, you know about these screenings. So I think we really need we need organizations that are the trusted messengers to make sure that our communities know that they have, you know, that they can access these screenings once they, you know, see their doctors.
Great. Guadalupe, can you talk a little bit about any resources that are being used to really help expand that access to ACEs information for communities? I know there's been talk about like promotoras and other folks screening for that. Are there things that can really support, you know, catalyzing this work, you know, 2 years into the pandemic?
Yeah, that's a great question. So I know that reimbursing community health workers, promotoras, is in the queue for, I believe, sometime next fiscal year. And I know that there's a broader proposal, you know, outside of the Medi-Cal program or in collaboration with the Medi-Cal program to expand the work of community health workers as well. So going to what Marisol said about trusted messengers, you know, we are thinking about how we can partner with community health workers to, you know, ensure that information is getting out there, to ensure, you know, successful implementation of our programs and services. You know, I will, I don't know if Dr. Mark has anything to add on, you know, on that front, but, you know, there is, you know, proposals, one already, you know, is in the queue, and then one is proposed as part of this cycle to really engage community health workers in our healthcare system and beyond, really, right? Because we're thinking about, you know, social determinants of health beyond just healthcare.
Yeah, and I would just add that certainly in ACEs Aware, we're really emphasizing the importance of team-based care. So, you know, screening is not something that just the physician does. There's really a whole team of people that can include community health workers and others that work together to do the screening, to support the patient, to refer them to resources that they need, and acknowledging how important it is that that community within the provider's office, you know, mirrors as closely as possible the community that the provider is serving.
Perfect. Thank you so much. Jeremy, can you talk a little bit about, you know, some of the work that you're doing to really weave together some of these resources that are coming to community? Specifically, you know, here in Kern County, you know, we have a number of communities that live in city proper, but then we have a lot of folks that live in the rural community. How are you deploying regional strategies to really support, you know, those communities in need, who can benefit from ACEs and could benefit from resources that address their toxic stress?
Yeah, so, you know, it's interesting. They were just talking about, you know, training the physicians and healthcare providers, which is awesome. And we're trying to take that even a step further. We have trained, and I'll use Head Start again as an example, but we train all of our support staff and teaching staff in Head Start in trauma-informed care. And when our children are enrolled in our program, they all receive assessments, ASQ, SE2 assessments. And we provide family wellness screening on behalf of the parents and identify family risk factors, et cetera. And I think if we're really going to battle inequities in our system and ACEs, we really need to start incorporating it into our programs that we operate, even beyond healthcare, because some of the early eyes and ears on these families are going to be social workers providing the programs. And if they're trained correctly, and it's going to take a tremendous amount of resources, but I think I would encourage agencies that are operating programs to try and incorporate this type of activity into their funding sources when they can. Head Start has enabled us to do that. Like I mentioned, we have wellness teams that meet with the parents and the families and really address this issue. I think we're at CAP-K, what we're trying to do is embrace that model. We've been following that model and spreading it out to our other programs, and incorporating these types of screenings and trainings in all social service programs in the state, I think would be, vitally important to the state. It's going to take a lot of resources, but I think California would really be a leader in breaking down inequities and breaking down generational poverty if we're able to figure out a way to do that. So we incorporate that thinking, at least. Sometimes it's not as easy as it is in Head Start to do it in all of our programs, just because of different contracts and funding sources we have and budgets. But we try and incorporate that type of thinking in all of our programs, and we're in this for the long haul, and it's going to take time. But we're talking about kind of rethinking how we deliver some of these services, and we think the benefits to our society and to those we're serving will be tremendous.
Thank you so much, Jeremy. I think one of the things that we've heard today's conference, right, adverse childhood experiences have kind of been exacerbated because, family have lost loved ones, toxic stress that has resulted from like job loss or, house being unhoused because of the pandemic and things that are happening. And so we have adverse childhood experiences, but I think the other, what we call the pair of ACEs, right? Adverse community environments where families are, exposed to, toxins and other environmental hazards that impact their health and well-being. What resources or strategies are being deployed through your respective organizations to really address the adverse community environments in which families live, work, play, pray every single day? So if any of you can speak to those issues, that would be great.
I'm happy to start. I think, I'm happy to share some of Senator Hurtado's legislation that she is, championing this year. Like I mentioned in the beginning, she will continue to advocate for food for all. Just making sure that sometimes, we have to make sure in order for our communities to thrive, they have to make sure that their basic needs are being met. If they don't have food on the table, then they can't, they can't contribute to whatever the society wants them to contribute. So I think oftentimes we have to unfortunately go back to the basics and making sure that their basic needs are being met. So I think that's one bill, that's SB 464. Another proposal that Senator Hurtado is carrying this year, I think oftentimes the region she represents, the drought affects our community members. I know that in Kern, in Fresno, there's just drought is affecting. So she currently has a proposal, SB 1066, which would, help support families, in particular farm workers, I think, that are not making, ends meet because, farmers are not providing, jobs or not providing jobs because of the drought. They have to follow land. So how do we support these farm workers for them not to, get even deeper into poverty? So what Senator Hurtado has a current proposal that would really help, these farm workers to be able to access, certain dollars per month so that they can make their basic needs. So that's a proposal that we are championing this year, and we're hoping to, receive funding, for during the budget process. So those are two proposals that, that Senator Hurtado is championing. I'm happy to talk a little bit more about her other proposals.
Great. Guadalupe, any resources being deployed to address the adverse community environments from the administration?
This is a little bit outside the scope of my policy expertise. So unfortunately, I don't have anything that comes to mind for this question.
No worries. Dr. Mark?
Yeah, I can certainly explain as part of our Medi-Cal's CalAIM effort. We are addressing a number of social determinants of health that we recognize are just really key in ensuring that people stay healthy and live as healthfully as possible. So for example, we're rolling out something called community supports that will provide certain types of support to folks. One example would be medically tailored meals. So someone who is, perhaps struggling with food and has diabetes and is having trouble controlling their diabetes and is having multiple, emergency room visits or hospitalizations. One of the ways that we can control that and prevent that and support that person to stay healthy is to provide medically tailored meals that are appropriate for diabetics. And then that will help their overall health as well as providing appropriate food for them. Another example would be providing enhanced care management for people who might be at risk of homelessness or struggling with homelessness, and providing some supports in that area so that folks can get housed and be able to better take care of their health.
Great, thank you so much. I think one of the things that we heard throughout the day is this kind of how collaboration has been expanded because of the pandemic and having to pivot and shift and to meet the needs of communities. Let's start with you, Jeremy. Can you talk a little bit about some of the collaboration that you've seen here locally or regionally as you've kind of deployed different strategies to support communities in need? And then we'll shift over to the other speakers through your own system.
Yeah, you're right. I mean, one of the things the pandemic shined a light on is the need for breaking down silos and barriers, and again, getting back to this term, the holistic approach. It kind of forced us to do that a little bit more. And when you take a step back, sometimes you get through a crisis like this, and you when you're in the moment, you're getting it done, and then you take a step back as you get a couple years into it. And I mean, what the state of California has done during the pandemic is amazing, and it truly is. The electeds and the social service providers and the contractors in the state have been amazing in working together and setting aside barriers and silos and coordinating efforts. It's been a real blessing, I think, to those in the state, and it really showed what we can do if we do take a more holistic approach and view whole families and holistic families as a service rather than individual needs of any one person. So, I mean, we worked with all the nonprofits in California, in Kern County and the state on multiple coordinated efforts through our food bank, utility assistance and rental assistance. We ran some great rental assistance programs to keep people in their homes. Housing for the harvest, we made sure farm workers could continue to do the work so we could all eat. They couldn't stay home and work remote if you're a farm worker. So there was just, we worked side by side with many of the electeds and many of the other service providers in our community to make sure the farm workers had safe places to quarantine if they got sick, that they had meals, that they had the ability to take care of their family and keep going to work. And, I think one of the things the pandemic shined a light on was the inequities of not just the healthcare system and some of the services we provide, but the fact as a society, many of us got to stay home and work remote. And many of those that weren't able to do that were the low income minimum wage workers. They really shined a light on who's doing that work, the essential work in our community, we'll call it. They couldn't stay home and work remote. And we worked really hard at Cap County, I know, to try to support those families that still need to go to work, that still need to provide the services. We were all working remote and we still wanted to be able to go to the drive-thru and get our hamburger or whatever. And people that were on the front lines doing that and restocking the grocery shelves and driving the delivery vans and things like that, and out servicing farms and working in agriculture. It really shined a light on that. And I'm proud of what the state of California has done and did during the pandemic. I really am. And I think the state and the local service provider should be applauded for what they've been able to do. Now, I think coming out of it, it's really taught us some lessons and hopefully refocus some of our services, like we've been saying all day, to a more holistic approach. And it offers, sometimes tragedies like this offer the ability for us as a community, a society, to focus a little bit better and make some changes where needed in some of the services we're providing, to really focus on the inequities and building on this ACEs theme of serving a more holistic approach.
Thank you so much, Jeremy. Reactions from either other panelists? How has collaboration really been at the forefront during this pandemic?
Yeah, I think, collaboration is really important. I think, in particular, I think the work that we do in here in Senator Hurtado's office is that we got to hear from our communities. We have to really hear what are the problems. I think you guys are oftentimes the experts. You guys have, if an issue is arising in the community, you guys are the best suited to be able to say, hey, this is an issue, and then come to our office, and then we try to figure out a way, how do we solve this issue? What is the issue? And maybe sometimes, unfortunately, is the lack of resources. So I think Senator Hurtado is constantly, we try to work a lot through the budget process, because we understand that these investments are needed. And I think collaboration is often really important to be effective and to make sure that the community needs are being heard. And I think, partnering up with Jeremy, I think our office has in the past, and I think just making sure that we're aware. I think that we're aware of this issue really help us really align our legislation and our budget priorities.
Great, thank you.
Yeah, to build off of that, I think, as practitioners, as individuals on the ground who are making these programs work, who are implementing, these investments, it's important, like Marisol said, to continue making your voice heard, through the policy and budget process. A lot of times when we get proposals, we're asking the who, what, when, how will this investment, how does it align with existing programs? How will it drive change? Who will it impact? How many people will it reach? So, I encourage you all to continue to engage in the state and budget, policy and budget process, as well as, I'm sure Dr. Marks is more aware, but we have, various stakeholder engagement processes for ACEs, for CalAIM, for many of the programs that we're implementing. So, in terms of your question, Hector, on collaboration, just really continue that collaboration and continue to make your voices heard.
Great. Dr. Mark?
Yeah, I would certainly agree. We have our Trauma-Informed Primary Care Advisory Committee, which advises us and is really our eyes and ears on the ground for folks, letting us know what's working in ACEs Aware, what the needs are, where we need to direct future funding in terms of supporting communities, bolstering certain areas of effort. So really look forward to working with all of you and letting us know what you need in your community.
Great. One of the questions that came into the Q&A is, a lot of our communities here in the Central Valley rely on family resource centers as those trusted messengers to support their health and well-being of their families. Dr. Marks, as we think about CalAIM and some of the things to address social determinants of health, is there a role for community-based organizations or family resource centers to tap into, some of the changes that are coming down from Sacramento to do that work?
So, yeah, there certainly is a role for community-based organizations in a lot of this work. Certainly in the ACEs space, the networks of care that we're building include a lot of community-based organizations, and some of the supports that I described that will become available or are now available through CalAIM are often provided by community organizations that are contracting with managed care plans. So there's lots of opportunities there.
Perfect. Thank you so much. One of the things that the goal that Dr. Nadine Burke, when the ACEs initiative was created, was how can we shift toxic stress and cut ACEs in half in a generation? If you had a magic wand, would be able to lead into that transformational work, what would it be? What would be the strategies if tomorrow this could change and implement? What would those look like for you as an individual? I know some of you cannot respond as an organization, but as an individual, what would be some of those things that you'd like to see happen to really make sure that we achieve that goal that Dr. Nadine Burke Harris has set for the state of California?
Well, if you really want to think big, this is fun. You get to think big. You get to think, hey, how could we deal with this? And I think, for me personally, if I had the magic wand, I think what I would do is require, I would have the state require all social service, CBO type program, social services, and it would take resources, but you'd have to address the whole family approach. And include all support staff being trained in trauma-informed care. And I'm talking about all social service programs, whether it's a food bank employee that's got their eyes on somebody, or a WIC staff member providing WIC services, or someone in a family resource center. Anybody that touches any funding regarding social services would be trained on trauma-informed care and adverse childhood experiences. And I think that would start I think a new and interesting era for us, where we could provide holistic family care and see, I think, I would hope, a breakdown of some of this multi-generational poverty that seems to be so hard to tackle. So that would be, if I had the wand, I would say, yes, that's what we're going to do. We're going to incorporate trauma-informed care and ACEs into all social service programs in the state of California.
Thank you, Jeremy. Other thoughts from other folks? I know it's a loaded question.
I just wanted to share that, Dr. Burke Harris certainly did set out a bold goal for us, but California is the only state in the nation that has really made an investment of this magnitude to really move the needle on ACEs and responding to trauma. So I think we've really done a huge amount in terms of providing some of these resources, and sort of echoing what Jeremy just said. The training that we have available now is available to anyone in the state. I mean, it's on the website. Anyone can go do it. And we've trained more than 20,000 California clinicians on the fundamentals of ACEs and toxic stress. So I know we have a lot more to do, but wanted to really just emphasize the really historic nature of what we've done.
I agree with Dr. Mark. And I think when it comes to our Medi-Cal program generally, right, like by January 1 of 2024, I believe we will be the only state that, that where all individuals that are eligible, regardless of immigration status, will be able to get health care, right? That's over 1 million people in California, which is huge. And I think, like Dr. Mark said, we're a model for the nation. So if I had, a magic wand nationwide, this would be accessible nationwide. Yeah, so I think for a long time, we've been incrementing, first it was our children, then it was our young adults, 50 plus, and now it'll be like, all income eligible Californians, regardless of immigration status. So I think that, I had a magic wand nationwide, but I'm really proud of where California's headed in the work that we've done.
Perfect. Marisol?
Yeah, I think I know Guadalupe talked, on the medical side and access to care. We did start with a certain group, but between the years with with the governor's office, we've been working there. But I think for me, if I had my magic wand, I think for me is access to food. So what that means is making sure that folks have access to food, and no matter your immigration status, that if you need food to put in the table, that you are able to access these food. So that would be, here in the state first in California, and then, ultimately nationwide and ultimately in the world. So that would be my magic wand request.
Perfect. Thank you for indulging me in that loaded question.
Mhm.
I know it's an opportunity for for us to think big and think about at some point ideas become fruition, they become policy, and it's often a small group of committed citizens who are often changing the way that we're thinking and moving. I know we're running up on time to conclude this panel, so just wanted to offer last remarks from each of you as you all reflect on this work, where it's moving, and some of the aspirational thinking that you all would want to really pursue and share with our attendees here today. So Dr. Marks, let's start with you.
Sure. Yeah, I just wanted to thank everyone for the work that they're doing in this area, and really celebrate that, we've now screened more than 500,000 children and adults throughout the state for ACEs. We have more work to do, but we've done a huge amount. If you haven't taken the Becoming ACEs Aware in California core training, I encourage you to do so. And if you're a provider, to attest to that training completion so that you can start screening patients and be eligible for reimbursement, and to share that with all of your colleagues, and not just in the medical area, but across the social services, as was discussed.
Perfect. Jeremy?
Yeah, I think, I think it's wonderful being here in Kern County, Central Valley, California, where we're really on the cutting edge of this. And I think being able to discuss this as a group here and talking about what we're doing is really exciting. I mean, I think we're going to see a big difference in California addressing generational and poverty. And I think ACEs is really the key to that. We've fought for so many years to try and battle this issue. And from our standpoint here at CAPK, we feel that this holistic approach through ACEs and trauma-informed care is really the key. And it's exciting to be in California where we're addressing these issues, and it's important to everybody. It's important to the electeds, it's important to the CBOs, it's important to the medical community. And we're going to see some progress. I'm very confident of it. I think we already have. And it's exciting to be part of this panel and here in California where we're leading the effort to address this issue. And it leads towards a more equitable and just society as well. So it's a key component of that too. So I think this is a wonderful topic, and I'm glad to be part of it.
Thank you, Jeremy. Marisol?
Yeah, thank you. And I think I agree with Dr. Mark and Jeremy. I think oftentimes, in the past, we knew these problems existed, and I think Dr. Nadine Burke does an amazing TED talk that she, when she talks about ACEs. But I think, I think wrapping the science behind it and saying, hey, this is science proven, I think really helps make sure that we're on the same page and making sure that we continue to fund, programs, and making sure that our communities and our trusted messengers have access to these tools. So I guess to close, my remarks, I just want to say that, Office of Senator Hurtado is always open. We are always open to hearing from you all. We do have offices in Bakersfield and Fresno and Hanford. So if there's any issues, always feel free to reach out to our office. This is your office if you guys are in Sacramento as well. So thank you for this opportunity.
Thank you, Marisol. Guadalupe, you have the last word.
Thank you. I echo what the other panelists have said. For you folks on the ground, practitioners, continue doing the work. Let's continue to collaborate and make our investments and programs, our innovative programs work. There's a saying, as California goes, so goes the nation. So let's continue being the model for the nation. It's been a pleasure to be here with all of you today.
Thank you so much. It's been wonderful to be in community and dialogue with you all. Keep doing the amazing work that you are doing in your respective systems. Can't wait to continue to lead the nation as we really support the innovation that's happening and translates from Sacramento all the way down to our local programs and our organizations. Appreciate your time, energy, and commitment to really operationalizing equity, advancing healing and practices that really support our families. And, you know, together, definitely we'll combat and tackle those difficult issues as we work towards transformational change for our communities. Thank you so much for your time and energy, folks. I really appreciate it. And so now what we'll do is we'll go into final reflections, folks. So I know I think there's like still 200 folks here on the call with us today. So want to give you all the opportunity to reflect and talk about, you know, what did you hear about today? What are the things that stood out to you? So if you raise your hand with the hand raise feature, we'll be able to unmute you and let you speak. Want to hear from a couple of folks, just how the day went, you know, what were some key takeaways as you all heard the different workshops, you know, panels that got us to really think about ACEs, toxic stress, the different strategies that we could be deploying and implementing locally and partnering to really think about this work. So are there any thoughts, reactions from anyone in the audience? Feel free to just raise your hand using the raise hand feature, and then we can allow you to speak. Okay, we have a few, so I'll let Jordan Green go for it. You're able to talk.
Hector, can you hear me okay?
Yep, I can hear you.
Okay, perfect. Just wanted to be sure. First off, just want to say thank you, Hector, and also the First Five staff and all of the presenters and speakers today. Very inspiring and also a lot of good information. Just to kind of talk about today and a couple takeaways that I have for you know, just my personal opinion. Lots of great information. It was really nice to have a lot of the websites shared and the opportunity to kind of learn more enhanced knowledge about ACEs, and then also a couple other community supports. I, for one, will definitely, you know, take what I've learned today and kind of apply it to, you know, the services we have over here in Greenfield. So once again, thank you so much, Hector, and I look forward to this conference again next year. Thank you.
Perfect. Thanks so much, Jordan. Anyone else? I see Lindsay. Go for it, Lindsay.
Hi, thanks. Can you hear me?
Yes, we can.
Yeah, I kind of have, I've enjoyed just the passion that so many of the presenters have had. It kind of re-energizes you in the work that we're doing that's hard so many days. I have like two kind of very specific takeaways. One was from the session where about toxic stress and how they build engagement and relationships and connection with their clients. And one of the things I asked was about the settings that they're doing that in. Now that we've had to shift so much with the pandemic and provide services in so many different ways, you know, what did they recommend? And they said, you know, really think about the variety of it and giving the clients a choice on how and where, and, you know, and so that was really, I've had in my head, like kind of going back a little bit to how we were doing things pre-pandemic, but it just reminded me that that's one of the strengths, is like just the flexibility that we've had and the different methods of delivery, and to not forget that. And then in the HUVA, I've really enjoyed the emphasis on self-care and how do we promote that in our offices and among our staff. And that's something that I just really needed to get some of those ideas about. So I love that.
Perfect. Thank you so much, Lindsay. One more folks that wants to share any final reflections, raise your hand and then we'll go. Mark Thibault, go for it. You can unmute yourself and speak. Mark, if you can just unmute your mic and then you'll be able to speak. I think Mark's having trouble. Anyone else? Mark, if you could put your comment in the chat, that'd be great. Okay, seeing we have no one else, I just want to kind of close us out then. Thank you for Lindsay and Jordan for sharing your thoughts and reflections for today. Today was the culmination of a number of months that First Five Kern was able to secure a planning grant through the ACEs Aware initiative to really bring together our network of care partners to really support this work. I think the goal moving forward is to continue to advance strategies that help mitigate the toxic stress that we see in the communities that we're serving day in and day out. Today, although we were not able to meet in person, we hope we were able to create a dynamic conference for you all. We're able to engage virtually, tap into different resources that exist. Those resources via the Whova app will be available to you all for the next 3 months. Once all the videos have been uploaded to the cloud, we will make sure to share out the recordings for the different panels and the different workshops that folks were not able to attend. I know there was a total of 8 different workshops that you were able to select throughout the day. So that will be made available to you all. And I think as we think about the future and what this work looks like, we also want to invite you to the 2nd annual ACES conference happening May 17th of 2023. We've secured the Marriott, which in downtown Bakersfield, which hopefully will be an in-person event to really have the dialogue amongst each other there in person to really support the work that we're looking to advance over the next few years as we support our communities. As our speakers, as our keynotes, as our panelists this afternoon mentioned, a lot of investment is happening across the state and coming into Kern County. So how can we partner and really think about the work that we collectively can do together to really advance the strategies that will help mitigate the toxic stress and help our families thrive? And so we invite you to join us. We have a monthly coalition that meets to think about how we advance this work and trauma-informed care principles across Kern County. There's also another funding opportunity that just became available that First Five Kern will go after to really support this work. And so if you either click on the QR code or that shortened URL link, I know Paula will also put it in the chat. We want to hear from you. How can we partner? How can we leverage the funding opportunity that will be made available over the next few months to really work together and advance the strategies that we called out here today, to really support our families, support the communities that we're serving across Kern County, across our region, to really support the health and well-being of those that we're engaging. And so we invite you to participate in those monthly meetings. We invite you to fill out that Google Doc and let us know how you want to be involved, if there are ideas that you all want to materialize, let's brainstorm and think about how we put that plan to action to really make this happen and advance the ACES work that will take place here in Kern County. And with that, I also just want to conclude by thanking our sponsors, Bakersfield American Indian Health Project, Kaiser Permanente, Anthem Blue Cross, Kern Family Healthcare, who have been invaluable resources to really make sure that we're able to have the resources and different workshops that were put on today to really support the work that's happening across Kern County. And also our continued network of care and partners who have been instrumental in moving the ACES work here in clinical settings, in community settings, in school districts. And these are the organizations and individuals who have a passion for solving this. And so we want this list to grow. So the invitation is open. Please feel free to connect with us. First Five staff, our emails are available through the Whova app. We will be sending up a follow-up email afterwards so that y'all can connect and take advantage of the resources that were deployed here today. This is just the beginning of invaluable work that will continue on for years to come here in Kern County. So we look forward to partnering and collaborating as we move forward. Thank you so much for your time, participation, and we look forward to scheming together to get into some good trouble to really support our families. Have a wonderful rest of your afternoon. Thanks, folks.